Oregon has received its first shipments of Pfizer's COVID vaccine, but that is just the beginning of a challenging logistical puzzle. To help us put some of those pieces together, we have an expert joining us live. Dr. Joe Sullivan is a senior health advisor with the Oregon Health Authority. Dr. Sullivan, now that we have that first shipment, can you briefly explain the plan for those initial doses?
The first doses are going to go to people who work in hospitals. That includes healthcare workers and all the employees at those hospitals. And it's going to go to residents and staff in skilled nursing facilities. We know that we have to attack this problem from two problems: keeping our supply of critical healthcare workers healthy, and we have to decrease demand for those hospital beds. And so we're giving those to the sickest people who are most likely to fill those beds.
I know there's a lot to consider. Distribution, cold storage, even combating misinformation about the vaccine. How is OHA thinking about priorities to make sure that this goes just as smoothly as possible?
Well, what we've decided to do is for those hospitals that are larger and that in those counties that have large number of healthcare workers, we're sending the more difficult to manage Pfizer vaccine. They tend to have ultra cold storage. They have a little more sophistication to be able to give and manage that type of vaccine. For a lot of Oregon, though, those are smaller hospitals, smaller locations. And so those are getting hopefully the Moderna vaccine that we hopefully will get approved or authorized by the FDA this week. And so for the smaller counties, smaller hospitals, they will get the more flexible Moderna vaccine.
I've got to ask you about this one, too, because a lot of people have said they're concerned about how fast the vaccine was developed. How confident are you in the effectiveness and the safety of it?
I am very confident. The FDA has fortunately been incredibly transparent about all of the data. So all of us scientists can look at the actual data for these studies. So the effectiveness is quite clear, and we are very fortunate, especially during this pandemic, to have two vaccines that are 95% effective. That's really almost unheard of. As far as the safety goes, they have gone through every safety step that any vaccine would go through. And the trials that have been used to make these decisions are sometimes 5 to 7 times larger than regular vaccine trials. So we have a lot more information on a lot of people.
So we're still seeing, unfortunately, people die of COVID. Oregon just reported more than 1,000 new infections yesterday. Most of us will not be getting this vaccine until later this spring. How do we approach these next critical several months?
I mean, we have lost a lot of people, and it's scary to think that by March we will lose as many people in the United States as have been lost in all the wars, all the combatants for the United States in the last 100 years in 1 year. But maybe this is a time to redefine how we can become great again as a country, and redefine patriotism in the time of COVID. And that is, patriotism may mean at this time wearing our masks, socially distancing, keeping our get-togethers small, and getting the vaccine, because we need 70% of adults to get this vaccine. We need to redefine what it means to be Oregonians and Americans during this time of crisis.
Dr. Joe Sullivan, thank you so much for joining us this morning and walking us through this very important information.